Wonderful. Well, thank you all for joining us today. As Dylan said, my name is Megan Salvin, and I'm a managing attorney with Disability Rights Maine. And I'm joined today by my coworker, Jennifer Battis.
Hi, yep, my name is Jen Battis, and I'm the Health Equity Project Coordinator here at Disability Rights Maine.
Yes. And as Dylan mentioned, we do normally have another self-advocate and youth self-advocacy trainer with us doing this training. However, they unfortunately weren't able to make it today. But that is okay because Jen and I are here and we are ready to jump in on all things health self-advocacy. Perfect. So, as you all know, you have joined us today to learn about taking control of your health, how to become your own health advocate. Health is obviously such a universal topic that everybody has a buy-in for. And I really think also around health advocacy in the healthcare system is such an important skill to learn. It's not something that's commonly taught in schools. And a lot of the times people have their parents helping them when they're children age going to the doctors. And then all of a sudden you become an adult and you're in charge. And that can be really stressful. I even get nervous before doctor's appointments and handling insurance. And so we created this training as a way to help educate transition age youth and any age, honestly, about how they can become a better health self advocate. And so, as all DRM trainings, this is only for educational purposes. Nothing in this should be considered legal advice, and that's not being offered that way. And so, if you have any questions about that, feel free to reach out. So, for those who maybe have not worked with Disability Rights Maine before, we always like to start off our trainings with a little bit of background about who we are. So, Disability Rights Maine's mission is to advance justice and equality by enforcing rights and expanding opportunities for people with disabilities in Maine. Who we are. So, we are part of a national network of protection and advocacy organizations, commonly referred to P&As. Every state in the country and all US territories have a protection and advocacy agency. And so we make up one big national network. As a nonprofit agency with a volunteer board of directors, it is a requirement for us to have at least 51% of our board members be individuals with disabilities. Maine is Disability Rights Maine is Maine's only cross disability advocacy organization, meaning that we don't specialize in one specific type of disability. We are able to help individuals across the spectrum. And we operate statewide. So we have multiple teams that operate in multiple different areas of the state. But if you're a Maine resident, our services are available to you. Some key priority areas that Disability Rights Maine's focuses on amongst our teams is to eliminate abuse, neglect, and exploitation, especially in facilities and institutions. We aim to reduce the use of guardianship statewide, as we have found that it is wildly overused in our state and across the country. So a big portion of my job is actually to helping with terminate and limit guardianships. We work to improve access to disability-related support services, including access to due process. So if people are denied eligibility or they're having rights violations issues in their supported home, that is where we come in. We also will work to challenge housing discrimination, ensure access to voting, and increase access to inclusive education. In terms of our services that you can expect to receive if you reach out to us, information and referral, we always say that if we aren't the ones that can help with the problem, we do our best to provide you with information and resources of people who can. We will provide individual advocacy. So we open up a case for an individual and we provide that individual directly with advocacy assistance. We will provide legal representation in different levels of court and probate courts and things like that. we issue trainings like the one we are in today, and we train on a vast array of topics, but all centered around advocacy and disability services. We offer assistance with self advocacy, similar to this training, or just working with clients one on how to build that skill of self advocacy. And then finally, a big service we offer is outreach and monitoring. So we'll start projects and we'll go into provider-owned homes or community support programs, and just to keep an eye on things. And we also provide outreach, so reaching out to clients across the state or potential clients across the state, just to know that letting them know that DRM is here and that we can offer them services if they need. So the best way to request assistance from us is to either call our intake number and schedule an intake appointment, or if you're not as big about doing phone calls, we do have an online intake form that is linked in this, and as well as that QR code. We take and address every intake we receive. If we're unable to open the case, you'll receive a letter or an email from us explaining why and containing some of that information and other resources like I talked about previously. Or if we do open a case, you'll hear from whichever advocate or attorney the case was assigned to. So now getting into kind of the purpose of why we're all here today. So rights around your health. So before we get into kind of this checklist we've created, we wanted to establish a good base of where these rights come from and what they mean. So some of the sources of the legally protected rights that include healthcare rights, obviously the US Constitution and the Bill of Rights. There are various federal and state laws. A very big one that is important to us, especially with reasonable accommodations, is the Americans with Disabilities Act, commonly referred to as the ADA. There's also the Supreme Court Olmstead decision that really was the first big shift away from individuals with disabilities being institutionalized and shifting more towards those home and community-based services that we now see across our state and our country. And the Home and Community-Based Services Rule, or HCBS settings rule, that you might hear a lot about. So, what are some medical care rights? So, these are rights that all of us in this training have. So, one is you are entitled to receive prompt and appropriate medical services. And what that really means is, seeking medical care when you think you need it. I always emphasize when you think you need it, because as you should know, the person who knows you best is you. And so it's not for staff to determine whether or not you should go to the hospital or get a doctor's appointment. It's not for a guardian to decide if you can go seek medical care. If you think you need medical care, you have the right to go and seek it. You have the right to have the doctor talk to you, not just your staff or your guardian. So it is more than acceptable if you need a support person in the room with you to help talk with a doctor and understand information. That's an accommodation that anyone, that someone with a disability is entitled to. But what we want to make sure is that if you have that support person in the room, your doctor is still addressing you directly as the patient, because it's your body, it's your health. And so they should be speaking to you. If they tend to start speaking and looking at only the guardian or only your staff, feel encouraged to speak up and remind them that you're the patient and that it's your health being discussed. So you would like the doctor to speak with you. You also have the right to talk with your doctor alone, even if you are under guardianship. I do put the caveat with that is if you talk with your doctor alone, they might still turn around and tell your guardian what it is you talked about, because under guardianship, there is less privacy amongst that medical provider role. However, if you would like to talk with them independently, you have the right to ask whoever else is in the room to exit. So you can ask them a question or go over some concerns you might have. So getting into rights around medications and rules around medications. So medications should only be administered at the written order of a doctor. So anything that you have been prescribed should be prescribed by a medical doctor. Medications cannot be used as punishment, for convenience, or as a substitute for a habilitation plan. So, what that really means, especially for that convenience part, when you think of certain medications that people take maybe when they're having behavioral issues, staff should not be overly medicating individuals, or guardians should not be. It should never be used as a punishment, or for a way just to get someone to maybe stop doing what the staff wants them to stop doing. Medication should be followed and used based upon the prescription and what the doctor has said. There should be no unnecessary medication or excessive quantities as well. So some of like criteria around medication, there should be a daily log of medications being kept, either by yourself or staff or a guardian, just making sure that if you are on medication, it's being taken appropriately. Any list of medications that you have must be reviewed by a doctor at least every 6 months. And kind of going in with that is all prescriptions must have a termination date. So there shouldn't be any just indefinite medication taken going on. After 6 months, the doctor should always be reviewing, making sure that it's okay that you still take that medication, seeing if it's time to make a change. And there should always be that termination date when you need to re up that prescription and go talk with the doctor again. So here's a little true or false, a test of the knowledge based on what we've talked about so far. And so what I would just ask is people put their answers, true or false, in the chat. So if you attend a doctor's appointment with your staff or a natural support, the doctor can ignore you and only speak to the person you brought with you. So is that true or false? People want to put it in the chat. Perfect. Seeing one. Anyone else wants to answer? Okay, perfect. Wonderful. Well, I see Eric and Alyssa nailed it, that the answer is false. If you have the right to speak directly with your doctor, and they should be talking with you, not just your staff or your guardian. So great job, Eric and Alyssa. So, surgical procedures and rights around those. So, the biggest takeaway to know about surgical procedures is every surgical procedure requires informed consent. And so, informed consent in the healthcare world means that a doctor has explained the purpose and the nature of the procedure, has explained any natural consequences or permanent consequences of that procedure, potential risks and benefits of partaking in that surgical procedure. So, what might happen that could be risky or what might be beneficial. They should be providing available alternatives as well to give you something to weigh your decision against. And really, the important part about all of that information is should be provided to you in a way that you best understand, and you can including like plain language or visual graphics, anything that you need to better understand what it is the doctor is explaining to you. Because I think we've all been in an appointment before when doctors start talking like doctors, and it can be hard to follow and understand what it is they're saying. And so if they're going through the purpose of your procedure and potential risks of it, but you're not understanding what they're saying, that's a time to kind of call a timeout and explain that you want to better understand the information they're giving. Ask if they can provide it in more plain language or whatever way that you best receive that information. You must give expressed or informed consent before any surgical procedure, and the doctor must give you information about the procedure that is fully understood. And so that's something that everyone in here should take away from this, is that informed consent is always required, and it's only informed consent if you understand the information being provided to you. Next piece is briefly about sterilization. So, in the law, a person with an intellectual disability or autism may not be sterilized without court approval if under guardianship. So, just because someone has a guardian, that guardian does not have the authority to have that person sterilized without going to court and getting a court order. If that person is not under guardianship, and so this is a choice coming from the individual, because people can choose to tie their tubes or get a vasectomy if they just don't want to have children. But that's when that informed consent comes in. So before that procedure happens, you and your doctor should be sitting together and talking about what to expect for the surgery, what the risks and benefits are, the alternatives, everything I just talked about on that previous slide. And so I've mentioned guardianship a bit with this because it does change some things, but not a whole lot. And so even if you're under a guardianship, you have the right to make medical decisions about yourself. Guardians under the Maine probate code should be asking you for your opinion and listening to your opinion about your medical care and other services that you receive. Um, so there's in 2019, Maine actually changed their probate code and really made it better in terms of guardianship, I would say, because it really outlined the clear duties of the guardian. And one of them, which is one I say a lot during my work, is the guardian shall make the decision that they believe the adult would make, unless doing so would unreasonably harm or endanger the welfare or personal or financial interest. So it's kind of like a bunch of legal words, but really what it means is even if you're under guardianship, if you're making a decision for whether it's a case manager or something, a surgical procedure, medication, if that decision, what you're making, doesn't unreasonably endanger your health, safety, or financial welfare, then your guardian has to make that decision that you want. Even if they disagree, if they think there's a better option, as long as your decision is not unsafe or unreasonably putting you at risk, then your decision is what should be happening. Obviously, if you're making an unsafe decision that could harm you, that's when the guardian's power can really step in. But I want people to know that just because you have a guardian, they don't have a total and final say over what happens and what decisions happen in your life. You still have a say. So another true or false. You can provide informed consent to a surgery without your doctor telling you about the potential risks and benefits of the procedure. Is that true or false? So again, if people want to put it in the chat. We'll give it a couple more seconds, but if anyone feels like putting in the chat whether it's true or false. Perfect. Thank you, Caleb. Yes, false is correct. So, to give informed consent, your doctor must explain the risks and benefits to you in a way that you understand, as well as the purpose and nature of the procedure, potential consequences, and those available alternatives. All of those key parts that make up informed consent. Oh, and thank you, Eric, as well. So the next thing I'm going to talk about briefly is the right to request a reasonable accommodation. And so this is under the Americans with Disabilities Act. And so what a reasonable accommodation does is it allows a patient with a disability to enjoy equal benefits and privileges of receiving medical care. So what that means is sometimes, even though we wish it was, not every hospital or hotel, every public space isn't always designed with people with disabilities in mind. They'll write their own policies and procedures, a set of rules that they've decided to follow. But sometimes those rules accidentally exclude people with disabilities, and they might need some help to get around some of those rules or some extra support in order to meet them. And so that's where reasonable accommodations come in. It's basically saying, I'm an individual who has a disability. Because of my disability, I currently don't have equal access to your waiting room, to your hospital, to the library, whatever it is. And because of that, I'm requesting this specific accommodation that will allow me to access it like everybody else. So, some examples to know. So, waiting rooms in doctor's offices. I don't know about you guys, but I've definitely found myself waiting in those rooms for 20, 30, 40 minutes. I've definitely heard people wait over an hour. And that's okay for me. I don't have an issue with sitting in that room, other than maybe being a little annoyed that I'm waiting so long. But other people can't necessarily sit in the waiting room that long. Sometimes with sensory issues, the lighting is too harsh, there's too many people around. They might be immunocompromised. So the longer they're in the hospital or doctor's office, it's not good for them. So they can request a reasonable accommodation that they'll check in at when they get there, but they're going to go wait in their car, and they ask that the receptionist give them a call when it's time for them to go back. So it allows them to avoid having to sit in that waiting room. And it's just a very small ask on behalf of the hospital to just, for this individual, allow them to sit out, wait wherever they need to, and they'll just give them a call to come in. Same thing with having a support person. Sometimes offices are, if you're an adult and you don't have a guardian, they'll say, oh, you can't bring anybody back in the room with you. Well, that's, if you don't need someone, that's fine. But if you're someone who feels that you need your support person, whether it's a case manager, staff, a friend, family, you can request an accommodation stating that you're asking to have the ability to have someone come back with you to help, they'll be listening just like you are to what the doctor's saying. They can help you communicate to the doctor if you're nervous or if you have questions. And so having that support person back there with you is another accommodation. I also mentioned plain language. So the doctor's office maybe hands you some directions for new medication or for a plan for treating whatever ailment you might have, but it's all written in doctor language and you can't really make sense of it and it's not very clear. You can ask for the hospital to write that for you in plain language in a more clear and concise way. And so those are just some examples of a reasonable accommodation, but they're really, the possibilities for them are endless. And so if you ever have the need for an accommodation and you need to know more, feel free to contact our office. We are always happy to provide technical assistance on how to do it. It's quite simple. But I just want everyone in here to know that you have the right to a reasonable accommodation and that accommodations will be person centered. So it'll be about, what it is you need. So just something to know. So now we wanted to go over, so we created this cool health advocacy checklist. So as we've talked about, being prepared and able to advocate for your health needs is really important to living a healthy and independent life. So we figured to take control of your health starts with you. And so here are just some ways that you can start owning your own health and going into your doctor's appointments and doctor's offices more confidently. So, step one of the health advocacy checklist. As you see your doctors and providers, it's important to save their contact information, either in a contact book or your cell phone, whichever you tend to use more. But it's really important to have somewhere accessible to you that has the name and the type of your healthcare provider, what their phone number is, what their address. Um, just because also sometimes you could find yourself with a new provider and they might be asking you about your history and who you've already seen. And instead of having to stress and remember that at the top of your head, you can pull out your already saved contact list of all of your providers and go through and pull out what you need. So, really, we just want to stress that keeping your provider's contact information will make it a lot easier for you as you move forward in your healthcare journey. Step two, health insurance. It is very important. So make sure you get a copy of your health insurance card. You don't have to keep the physical one on you if you don't want to. However, you do have the right to do that if you would like. Um, One way that's really easy is you can take photos of your health insurance card because the card itself isn't needed at the office. It's just the information on it. So take a picture with your cell phone or make photocopies to bring with you or keep at a folder at home. But it's just always really helpful to have that health insurance information accessible to you at all times in case maybe you're traveling and you have to unexpectedly go to a provider you haven't seen before. They're going to ask for your health insurance information. And so if you just already have it ready to go on your phone or a copy of it in your wallet, you'll be much more prepared and not have to worry about getting that information to them. Step three in the healthcare checklist is trying to be as independent as you can, even if you have a parent or caregiver with you or guardian. So, really working to schedule your own appointments, check into your appointments, filling out forms to the best of your ability. We just feel that if you have someone in your life that typically schedules your appointments for you, like your case manager or your guardian, that's okay, right? It's okay to need that support and help. But whenever you feel ready, you can ask them to sit down with you and walk you through how they make your appointments. They can give you the phone number that they call or show you the website or portal they use. And maybe they can start, you guys can start doing it together. And then eventually, maybe you'll feel confident enough to schedule your own appointment. So you can say that, whenever you want, you can start telling them that you want to start taking over this role and ask them for that help in your transition. Because being independent is always the best way to build your confidence and building those skills when you're advocating for yourself. So, step four, when preparing for an appointment, it's really a great idea to try to remember and write down key events and dates of either your personal medical history or your family's as well. You might find yourself being asked by a doctor, does your family have a history of heart disease or cancer of some kind? So if you can, it's good to talk with your family now. Get that list of information so you're always at the ready. If you're going in for a specific issue, like a couple weeks ago, your shoulder started hurting, start documenting that when you think you might be going into a medical appointment, because a doctor will have a much easier time diagnosing you if you can walk them through all of the stuff that you've been feeling while for whatever reason you're there today. So, really documenting as much as you can beforehand will make that appointment go much more smoothly. So, this is a little bit like I said. So, when you're preparing for your appointment, make sure you know how to describe your symptoms. So, this means when it started and how it feels are the most important. So, did you start coughing a couple days ago, or did your throat, was it scratchy a week ago? Has this been going on for months? That can be really important for your doctor to know, and listing as many symptoms as you're feeling, because those will all be taken into account to diagnose what's going on. So when you're with your provider, you can also take notes and ask for handouts of the information so you don't forget what they're saying to you. So again, a kind of an accommodation of, if your doctor lists a bunch of information or directions for you to do, but he or she isn't writing any of it down, you can ask that they do that for you, and you can wait until they've gotten it done. But that's an accommodation you're entitled to, because it's really hard to remember everything your provider said. Medical appointments can be 10 minutes long or they can be an hour long. And so, documenting in whatever form of note taking you're most comfortable with will really be of benefit for you. Always, always, always ask your provider for more details or for questions if you don't understand what they're saying. We really want everyone to feel confident and comfortable in speaking up and saying to their provider, like, hi, pause, I don't understand what you just said to me. Could you say that again in simpler terms? Or I have a question about this medication you're prescribing. Just, your doctor is there for you and you are the patient. And so if you have questions or clarifications, that is the time to do it. And that's their role, is to provide you with that information when asked. And so now we've developed a couple of scenarios, which is just a way to kind of reflect on what we talked about, what we've gone through in these slides. So if people are comfortable, they can either write in their answers or what their thoughts are in the chat, or I think we have a small enough group. If people are brave, they can unmute themselves and provide their own feedback. So I'll read out the scenario and we'll go from there. So the first scenario is, you schedule an appointment for a COVID-19 vaccine. When you get there, you realize you need larger print for the forms because your eyesight is limited, and especially when the font is so small. When you realize this, you go up to the pharmacist or the vaccinator and do what? So you've been handed a piece of information that you can't read because the text is too small, but it's something you need to be able to read and sign in order to get your vaccine. So, what is something that you can go ask the pharmacist or vaccinator for? Um, and yeah, we can actually, I think we're going to pause the recording now so everyone can feel confident. We're not, in their answers if they would like to unmute.